Dental practice philosophy is very simple. We try to treat people the way that we'd like to be treated. And that may even sound like a corny tagline, but it really is the way that I try and reflect upon the dental patient's experience. The type of dentistry that we do in this office is extremely rewarding. A week doesn't go by that I have somebody thanking me for taking the time, for telling them how these things could get done, for actually coming through and delivering on what we talked about, and changing the way that they feel about dentistry. I feel incredibly empowered by the patients that I see. In many cases, patients will tell me that I've changed their lives, and especially changing their way that they think about the dentist. Having these relationships with people is really the thing that I like most about being a dentist. And, working on teeth and getting people healthy is fantastic, but it's the relationship, it's the person that's behind the teeth, to me, is what is the greatest part about dentistry. We really do try and treat the patient. We're not trying to just get you in and out. I typically see just one patient at a time. It's very simple. I talk to you beforehand. I let you know what I'm going to be doing. I'm going to tell you how I'm going to get you numb. If you don't want any information, I don't give you any information, but most people do want to know. And then before we start, I always talk to the patient. I said, now you're going to feel vibration. That's normal. If you feel any sharpness, just raise your hand. And to be quite honest, I'm usually quicker than their hand. If they're not feeling anything, I notice right away what's going on. And again, I try to treat people the way that I'd like to be treated. I don't want to be feeling anything. I don't want patients to feel anything as well. Just this Monday, I was doing an exam on a patient who had her regular cleaning. And I told her everything looked great. And I was about to dismiss her, and she said, I just want to tell you one thing. I said, what's that? She says, I first came here in 2002. And when I came here in 2002, you told me I needed a fair amount of dentistry done. And you told me if I did it, I wouldn't have to have any more dentistry done for quite a long time. She goes, well, I want you to know it's 2015. I said, yes, I know that. She goes, and I haven't had any more dentistry done. My mouth is feeling great and it looks great. And I'm really kind of amazed that what you told me is true. I believed in you at the time, but now I truly believe in you. And it's like, and I told her, I said, there's no greater compliment that you can give me because you appreciate. I get to see what we did, and I appreciate the fact that we did this stuff, but the fact that you as a patient can reflect upon our conversation and tell me that the beauty of not having to see the dentist year in and year out for shots and drilling and all this other stuff shows the value of doing dentistry and doing it properly. There's no reason to be afraid of dentistry. At our office, we'll take great care of you. We'll do what we promised. You'll be in and out of here in no time flat, and you'll change the way that you think about dentistry. Simple as that.